Good morning, everyone. We're going to get started in just a minute. We're going to give some time for people to join. All right, we're going to go ahead and get started. Good morning and welcome to today's Recovery Summit session. This webinar is part of the Recovery Summit series hosted each September by St. Clair County Community Mental Health in recognition of National Recovery Month. A few quick reminders: today's session is being recorded and will be available on the St. Clair County Community Mental Health YouTube channel. Please use the chat box for any questions or comments. Our presenter will address them as time allows. For those requesting continuing education credits, please be sure to remain on the webinar for the full session and complete the survey that will be emailed to you. We're honored to be joined today by Corey Soper from Sacred Heart. Welcome, Corey.
Hi, thanks for having me. Good morning, everyone. Thank you for joining me. Today we are going to explore vicarious trauma. I thought I'd share with some of you who don't know me who I am. So I am a licensed social worker, substance use counselor, and certified clinical supervisor. I've been in the field for a while now, including working with the homeless population during the 2008 recession. I was in the foster care realm for a little bit, was in long-term care for a little bit as well. I was an outpatient therapist during COVID, and I somehow landed at Sacred Heart, and I've been here for about 4 years. I currently supervise a team of over 50 staff, including peer coaches, direct care workers, authorization specialists, and counselors. I wanted to present today on vicarious trauma as it's such a huge piece of what we deal with in the field, but there are very little conversations happening about it. And I hope today that we're going to bring awareness to the topic and influence workplace and field changes. So our overall agenda today, we're going to be defining trauma. We're going to look at the trauma cycle. We're going to talk about burnout versus vicarious trauma. We're going to look at the responsibilities of individual professionals as well as companies. And then I have some ideas for some next steps. So defining trauma. Bessel van der Kolk founded the Trauma Research Foundation and wrote the book, The Body Keeps the Score. A quote from his book really highlights what our professionals are fighting in their work. Traumatized people chronically feel unsafe inside their bodies. The past is alive in the form of gnawing interior discomfort. Their bodies are constantly bombarded by visceral warning signs, and in an attempt to control these processes, they often become expert at ignoring their gut feelings and a numbing awareness of what has played out inside. They learn to hide from themselves. That's just something that I constantly think about my team kind of being faced with every day and how we kind of work through that. So today, we're going to look at that a little bit more. We're going to just define the major traumas. There's lots of different subsets of trauma, but just to kind of give you guys an overview. Trauma, according to the American Psychological Association, is any disturbing experience that results in significant fear, helplessness, disassociation, confusion, or other disruptive feelings, intense enough to have long-lasting negative effects on a person's attitude, behavior, and other aspects of functioning. Post-traumatic stress disorder is a mental health condition that's caused by an extremely stressful or terrifying event, either being part of it or witnessing it. In reference to the DSM-5, 8 criteria is needed to be met in order for someone to be diagnosed with PTSD. Criteria includes the person was exposed to death, threatened death, actual or threatened serious injury, or actual or threatened sexual violence via directly or indirectly. This event is persistently re-experienced via memories, nightmares, or flashbacks. The person avoids triggers of the event and exhibits symptoms similar to depression and anxiety. Symptoms must last for 1 month or longer, not be related to medications, substance use, or illness, or create distress in the person's day-to-day life. The reason why we're all here today, vicarious trauma is the experience of absorbing another's pain in times of their distress so deeply that affects their own well-being. I put together this trauma timeline for you guys, and we're just going to kind of walk through it a little bit here, but I am going to hydrate, so bear with me. So I want you to look at this first image. A person has a traumatic event occur, and they're kind of dealing with that on their own. They go to a professional, and they're going to process that trauma with the professional. Once that happens, the professional becomes responsible for navigating that trauma with that person. And then that professional is left with the trauma remnants. And that's something that we kind of need to be aware of in our field. What happens to the trauma remnants the professional is now carrying is the big question. What do we do with those things? The professional continues to carry it. Something I want everyone to keep in mind is in the substance using population has a plethora of experiences that range from sexual situations to violence, to overdoses, to childhood issues, and so on. Also take into consideration, the SUD field employs a lot of different professionals, including peer coaches and counselors, but also staff such as nurses and customer service individuals. It's not unusual for clients to relay an experience to a professional that is not precisely trained to navigate it. I have yet to come across a professional from a helping agency that won't at least listen to a client sharing their story. But by simply listening, that trauma starts to pack itself for the professional like a carry-on bag when you go to the airport. It's also not unusual for substance use professionals to enter into the field due to their own ties to substance use and recovery and wanting to give back. So not only are we asking SUD professionals to cope with their own trauma and triggers when meeting with clients, we are now asking them to process the client's trauma and expecting them to be totally fine after sessions. Many agencies these days have productivity goals for their staff, so it's not unusual for staff to have to meet with clients back to back without time to really process what just happened in the session. All these factors compound and can lead to negative outcomes for the professional. More often than not, the professional is referred to as burned out. Supervisors will encourage the professional to self-care, take a day off of work, or contact the company's employee assistance program. The professional may have poor attendance, exhibiting a negative attitude or a lack of motivation to complete tasks. They may appear to be or feel exhausted. Maybe their hygiene isn't being maintained. They may participate in risky behavior. This could be anything from gambling to not paying bills timely. They begin jeopardizing their own well-being. As I previously stated, we have a lot of professionals working in the SUD field that are in recovery themselves. So the risk of relapse related to work-related stressors is a very real thing that could happen. And I know I've had staff that have had to help navigate them through that scenario. I really want professionals in our field to start reflecting and trying to figure out themselves in work environments and to start to differentiate between burnout and vicarious trauma. Burnout being a lot of things on one's plate, such as the shark here. And then vicarious trauma is being the plate that is still dirty when it comes out of the dishwasher. Vicarious trauma essentially takes burnout and magnifies it. As a professional, do I just have a lot of things going on with work and or personal life, or am I adjusting my life choices based on my work environment exposure? For the leaders that are on today, I challenge you to really look at your struggling employees and try to determine, is it burnout, maybe too many assigned tasks, or personal life issues happening that are affecting work performance, or is it a vicarious trauma response? Maybe you have a clinician that every time he or she completes a PHQ-9 depression screening, They think about the in-depth description a client provided them, how they attempted to end their own life. So they call in on the days they know they have to complete a new client intake to avoid having to complete that screening. They're altering their life choices, work attendance, income, what they are personally doing for the rest of the day based on those experiences. That would be vicarious trauma. Individuals who express burnout are often rewarded with comments to self-care, take a walk, take a break, with a company pizza party, or encouraged to talk to a mental health provider. Those are not necessarily bad ideas, but I want to challenge everyone in leadership that is on as to how those suggestions might come across to their employees, and how when we are truly dealing with a vicarious trauma situation, these solutions can be seen as not caring, out of touch, or band-aids for bigger problems. And employees that are on, I want to challenge you to figure out how you are communicating, what your needs are, and how those needs could be met by your leadership team. According to the Office for Victims of Crimes, vicarious trauma is an occupational challenge for people working and volunteering in the fields of victim services due to their continuous exposure to victims of trauma and violence. This work-related trauma exposure can occur from such experiences such as listening to an individual client's recount their victimization, looking at videos of exploited children, reviewing case files, or hearing about or responding to the aftermath of violence or other traumatic events day after day. Professionals experiencing vicarious trauma may exhibit irritable behavior, issues with interpersonal relationships, concerns about their own safety, or find themselves fearful in situations they were previously not. If you were in the field during the start of the pandemic, you likely experienced some vicarious trauma. I know when I would meet with my staff, we would frequently review COVID-19 policies and procedures, just simply because a client brought up a concern and the clinician absorbed that concern, ruminated on it, and then became concerned about contracting COVID. They also changed the policies 100 times, so we talked about it a lot. Other examples of vicarious trauma may include professionals working with sexual assault victims experiencing intimacy issues with their partners. Professionals working with violent clients may carry mace or obtain their CPL. As professionals working with substance using population, I want you to think about how many times you may have chosen a different route in your drive or walk because you're pretty sure there's a dangerous situation down your original path. Maybe someone looks like a former client, or the house was just raided by the task force. Altering your route for your own safety, that's not just being cautious, that's vicarious trauma. So I'm going to share a personal story here. Prior to coming to Sacred Heart, I was an outpatient therapist. Our office was fairly close to a Coast Guard station, so I got to see active Coast Guard service members. I was prepared to work with these individuals and help them with processing their experience of their service. One gentleman I saw was in search and rescue. He had some really great rescues and some pretty horrifying recoveries throughout his 20 years of service. One day he shared a story with me that was unlike anything we've previously processed. He was called to a beach buoy. A 12-year-old boy had been climbing on it and jumping off of it with his friends and family. Being a frequent beachgoer in the state of Michigan, I have watched many kids jump off of rocks, buoys, boats, and docks. Not an unusual sight to see. As he was telling me the story, I was mentally preparing for a situation like the boy hit his head the wrong way, maybe he was drowning, had a seizure in the water, or that he had passed away somehow prior to him getting there. Sorry about the phone ringing. Not my desk. On the bottom of the buoys, there are very large chains, and they are anchored in the water to stay in place. Those chains are large enough to be used as the perfect ladder for a young boy's foot to climb on to the base of that buoy to be able to jump off of it into the water. Unfortunately, this boy's foot slipped and somehow his calf ended up where the links of the chain connect. So when my client arrived, the boy was still conscious. He was barely above water. The search and rescue crew attempted to cut the chains of the buoy, but everything they did seemed to make the boy slip under the water farther and further lodge his leg into the chain. My client was responsible for that boy. His job was to keep him awake, get him air, help keep him distracted. My client ended up having to hold that 12-year-old boy still in the water while the other members of the search and rescue crew cut off his leg. It was either let the boy drown or take his leg. I was not prepared to hear that, but as a professional, I schooled my reaction and worked with the client on his trauma of assisting in dismembering a child. That is primary trauma. It has been 7 years since I heard that story, and I have traveled to many beaches throughout Michigan and in different states. Every beach I go to, I look over the horizon, find the buoys, and make sure there is not a little boy trapped or drowning. That is secondary trauma. That is vicarious trauma. So addressing trauma, how do we address it in the field of substance use? Based on my years of experience in the field and the multiple resources listed at the end of this presentation, it really comes down to the individual, professional, and company responsibilities. These responsibilities provide opportunities for prevention of vicarious trauma as well as resiliency when faced with a trauma scenario. The individual professional has the responsibility to establish and maintain strong boundaries with clients. This looks like not being available outside of session time and keeping the conversations relevant to the mutual goal of the professional relationship. Professionals also need to maintain good boundaries with coworkers. This may look like not picking up some work your colleague isn't able to get to because you also don't have the time. Professionals also have the responsibility to set boundaries with their companies. For example, not staying late when your kid has a baseball game or saying no to go over your caseload numbers. The individual professional must create and maintain their own regimen for their mental health. This doesn't mean you have to go to therapy. Therapy is an option, but this really needs to focus on you as the professional, creating spaces in your personal life to explore things that interest you and make you you. This could look like meeting with friends for breakfast, reading, playing Dungeons and Dragons, traveling, or playing with a pet. If you interview with me, I will ask you what you do for fun, meaning how are you investing in you? The individual professional must create and maintain their own regimen for physical health. Again, you don't have to run out and get a gym membership or join CrossFit. This could simply be walking your dog, gardening, or going to yearly health checkups. I know my staff is notorious for taking time off to get their loved ones to dentist appointments, physical therapy, or whatever other appointments their kids or spouses may have. But in the meantime, they may be eating lunch on one side of their mouth because they don't want to take the day off of work to go to the dentist for themselves. Lastly, the individual professional is responsible for their own growth and development. Professionally and personally, take advantage of CU opportunities such as this one, but also take it further. Are you satisfied with your current knowledge base, level of education, or your current position? If the answer is no, I question you, what are you going to do about it? Companies have the responsibility to provide opportunities for staff debriefings. This may look like regular staff meetings or case studies or one-to-one supervision. Companies also need to provide and allow opportunities for organic debriefings or staff communications. This looks like not booking clients back to back, being okay with your staff taking lunches together, or allowing staff to congregate together and talk. I know some leaders will think staff need to be productive while they are at work. Trust me, they are. When staff are talking over lunch about the guy that shared his childhood trauma and all are providing suggestions and ideas on how to move forward with his treatment, with the professional that is in shock or concerned about that topic, they are working. They are adding to that professional's resiliency factors. You are not alone, and you are giving that professional options on next steps. Again, that message, you're not alone, you have your coworkers' support. I encourage all companies to review their after hours phone and email policies. With our way of communication being in our hands at all times, it is very easy to text or email someone who may be scheduled off or is done for the day to get what we want right now. Companies need to allow their professionals to turn their professional brain off and to be in their personal life when not on the clock. Speaking of being off the clock, Michigan's labor laws require companies to provide time off for sick time, but it does not mandate vacation time or personal time off. If you are a company that promotes wellness, are you providing opportunities for such wellness to occur? I challenge companies to really look at their internal policies and figure out if those policies match your current employee culture. I've worked in this field for many years. When I was a social services director as a nursing home, when a long-term patient would pass, the administrator would allow their care team to take the day off, paid, and made it a point to check in on them when they returned. That really set the tone for how appreciated the team members are and how respected their work was. I also know some companies have well days, and if you don't take a well day every 4 weeks or so, HR will call you and tell you that you will be taking a well day and tell you what day it's going to be. This really shows staff that your health and well-being matters to us, and we're going to be here when you get back. I also want to challenge companies to look at their benefit packages. Can every person on your team afford it? So if I'm encouraged by my supervisor to go talk to someone about my mental health or schedule a dentist appointment for myself, am I going to be able to pay the bill at the end of those visits? If the answer is no, what are other options, opportunities, or ideas that can be brought forward? I wanted to take a minute to talk about happiness today, because a lot of times when you talk about trauma and vicarious trauma, and especially in our work setting, people tend to confuse that happiness with my response to my environment. So as professional employees in a field such as ours, it's very easy to take pride in our work and have that start to mesh in with our personal identities. That can come at a cost and does start to wear on the employee-employer relationship. It can affect an employee's wellness and company's productivity capabilities. I want to remind everyone that employment is a symbiotic business relationship. Companies need employees to do their assigned jobs, and employees need companies to pay them. Nowhere in any employment contract will you see a happiness clause. Employees are responsible for their own personal happiness. With that said, there is an old adage that take care of your employees and they will take care of your organization. So keep the responsibilities in the previous slide in mind for your day-to-day operations to maintain that symbiotic employment relationship and have a healthy, growing relationship with the culture of your company. I spoke really fast, so we're going to have to answer a lot of questions at the end of this. So next steps, professionals, you need to establish and communicate your boundaries, set personal goals, and work towards achieving them. You need to take care of yourself, maintain your physical and mental health needs, and lastly, be mindful of who you vote for, because that does affect a lot of our programs. So make sure it's someone you think that can help our work environments in the said field. Companies, I strongly encourage you to review your day-to-day policies and practices and work on addressing your internal culture. Debriefing after traumatic experiences in the workplace can make a huge difference in your employee everyday experience. Establish trauma-informed practices for not only clients, but also your employees. Apply for or establish funding routes to invest in your employees' well-being. Lastly, lobby the legislator to help bring employee health to the forefront of conversations. We cannot do what we do without a healthy staff to get it done. If you're interested in further resources, trainings, these are some good websites that I found. I know the PTSD 9/11 movie just showed at Macomb Community College. The Office of Victims of Crime, they have a really good toolkit that they've launched. And the Trauma Center, they actually have funding and grant opportunities available to companies if they are interested in them. So I think at this time, Christy, I will take questions if anybody has them.
As of right now, there are no questions in the chat. Give it just a few minutes and see if we get any.
Okay.
While we're waiting, do you think, I know you're from Sacred Heart, could you just give us a little information on what you do at Sacred, like what Sacred Heart does? And for us?
Okay, yeah. So Sacred Heart, we're throughout the entire state of Michigan. We have really great programs in regards to just about every level of care a client could need for substance recovery. So my location, we are the residential location for Richmond. My building's the co-ed building. Clearview is the women's specialty building, and they're right there on the same campus, the same parking lot as us. So what we do, we have the clients that are coming to us who are actively using, and they're going to come hang out with us for a couple weeks. They have to call access to get a referral. They go through our admissions intake process, and then they come in for programming. So they actually stay here inside of our building with us for anywhere from 7 to 21 days, depending on their funder. We do participate with all the funder sources in the state of Michigan, so that does make it a little extra exciting in regards to authorizations for my team in that regard. I have a therapy team that works with clients individually on their treatment goals, and then I have a peer coach team that works with the clients individually on their discharge goals, so returning back to the community. Also on our campus, we have outpatient therapy as well as the MAT clinic. So it's not unusual for a client to graduate our program and then just move literally down the hallway into outpatient services and come in and see us for therapy or MAT. But again, throughout the state of Michigan, we have different services. We have another residential site at Berrien Center, and then we have more outpatient services like in Port Huron, Madison Heights, Flint, and Bay City, St. Ignace as well. We also offer telehealth services. So if clients find transportation a barrier, they can also lean on us for to get services online.
All right. We do have a question. Tanisha said, how do you manage your own happiness?
How do I manage my own happiness? I have a stupid amount of dogs. I have 4 of them. So I make it a point to shut work off. I am someone who I am a salaried supervisor, so I am required to be available 24/7. But that doesn't mean I have to be on my phone 24/7 checking my email. What that means is if there's an emergency at the building, I need to be within a good distance of my phone to be able to answer it and to respond to the staff that might need me. Doesn't mean I have to drive into work. Doesn't mean I have to come help put out whatever fire has started. It just means that I have to be somewhat available. So understanding what those boundaries are and what the expectations of my supervisors are from me definitely helps me maintain what my happiness looks like. I am someone who grew up in an addiction household. So I've had to learn to set a lot of boundaries with my family personally through my own personal growth. But professionally, I like to do stuff like this. Like I was telling Christy before we got on here, it's been several years since last time I did a presentation, and it clearly shows because our time, I blew through this. But like challenging myself and making sure I'm not just staying comfortable, because I think sometimes when we are comfortable, we think that's happiness, but that doesn't necessarily mean they're the same thing. I have a great husband, I have a kid at home, and I just make sure I'm everything in that slide of like personal responsibility is that I'm taking care of my health. I'm making sure I'm taking the dogs for a walk. I'm making sure I'm staying up on my appointments. It's just stuff like that. I'm investing in me. Can I ask a question? How many of you guys think that like you have experienced vicarious trauma?
You can put it in the chat for anybody that wants to respond to that question.
Okay, and then so you've experienced it. Do you think that it was handled appropriately in your work environment or personally? Hi, Savannah and Tanisha. I finally opened up the chat. I got to figure it out. Okay, so Christy, you said that you've experienced, you don't feel it was handled adequately. What do you think could have been different? And then Heather, you said your coworkers handled it better than leadership. What do you think your coworkers did well? Okay, so debriefing with your supervisor, that definitely. So Christy responded to my question of in the moment, like kind of debrief with the supervisor on that same day is how she feels like that could have been handled appropriately. And I definitely agree. Savannah, to answer your question and kind of put this in with Christy, Savannah's question is, do you ever have conversations about post-traumatic growth with clients, staff? I do that a lot. That's kind of the reason why I wanted to present today on this topic, is because I do have these conversations with my staff almost on a daily basis, on making sure they are investing in themselves. And when we have a client that's yelling and screaming at us because we won't give them extra methadone or whatever it is that they want in the moment, staff don't handle that super well at different times. So making sure that they're okay, giving them a couple minutes to kind of get themselves together, and then checking back in on them. I, as a supervisor, I try to go to the staff member that maybe has experienced something, because kind of coming to my office, I understand it might be a little intimidating. They might think that they're in trouble after a situation like that. So just being mindful of the different relationships I have with staff is super important, as well as how staff perceive the situations. We've had a couple different situations that have happened here where staff have been violent. And some staff, they've been doing this for 20 years, so they just kind of roll with the punches. And then there's staff that you could clearly see that there was shock and awe. So seeing if they needed to go home for the day, checking in on them when they do come back to work. So stuff like that that's my responsibility as a supervisor. The responsibility as a staff that's in that situation is seeking out help, or if help is offered, trying to communicate appropriately. And sometimes when you're exposed to that stuff, you might not even know how to communicate. So just saying, I'm going to try to talk to you at a later time because I'm not really quite sure how to use my words right now. And that's fine. Melissa said, yes, I would say that I've experienced vicarious trauma at work. I've also experienced burnout twice. I have taken a lot of trainings on burnout since then. I attempted to express my needs, concerns at both places of employment, but felt that it was not taken seriously. I am currently reading Perfectioner, From Workaholic to Well Balanced, and working on having a more balanced lifestyle. That is great, Melissa. So definitely, it sounds like you're investing in yourself. You're trying to explore what your root causes are with your burnout, and you're looking at different things on how you can balance out that work lifestyle. That's absolutely something you should do. And I want to remind you guys, it's not always burnout, and it's something that we like to say in our field, like, oh, you're just stressed out, you're burned out. Like when I go to the beach is one of my happiest places to go, but I still have like those 2 minutes of stress of, is there someone at that buoy? So understanding that might not ever go away, but that's not burnout. That is that little piece of that client that follows me and stays with me. And that's okay, because in a way that kind of does help me in my life. Part of that story I wanted to share with you guys, but I wasn't sure if I was going to have time. That client shared that story with me about 7 years ago. And about 5 years ago, my husband and I went rafting. And it was terrible. We've never been rafting before. We always go canoeing. And I, of course, brought my dogs with me. And my daughter was about 5 at the time. And there was something on the shoreline, and my one dog jumped out. So when he jumped out, he knocked my daughter out of the raft that we were using. So my husband jumped out of the raft to go get her. And I'm not a good swimmer, even though I like to go to all of the water places. So the raft is going down the the river now. I am in the water, and my husband's in the water, and my daughter's in the water, but my feet became lodged between two trees or branches. And I had everything was flashing before my eyes, right? Of like everything that was going on. And I had that client sharing his story in my head. And he told me, don't try to go up, go down. Because the whole time we were processing his trauma, he kept saying, if his family just pushed him down into the chain and brought him out when it happened, the kid would have been fine. So he had a lot of regret and a lot of remorse that we were working on it. So I had that stuck in my head. So when I got stuck between the trees, the branches, or whatever, my foot was kind of lodged. I did the scary thing, and I went down and I broke the branch off, and I got out. And the river wasn't very deep where we were at. It was probably only like 6 feet, and I'm short, so 6 feet's kind of a lot for me. But when I got back, he wasn't my client anymore. But I did call him, and I shared my experience with him. And he came in and he gave me a big hug, and he said, thank you, because that's what I needed. I needed to hear that something good came out of that story. So even though I'm looking at buoys all the time, I'm also thinking, okay, if that situation happens, I know what to do now. So trauma doesn't necessarily always have to be a negative thing too. Does anybody have any things that they find that clients have shared with them that they carry with them? So Melissa, you had a client in the past that saw his mom shoot his dad, and that you carried that with you. So that is okay. So that is vicarious trauma. So is there something that you're doing to kind of help cope with that? Are you talking to your supervisor? Are you going to therapy, talking to your coworkers about it? How are you helping yourself kind of work through that experience? Okay, good. And you talked to your supervisor about it. So hopefully they were able to help you work through it. I'm going to share with you guys the Office of Victims of Crimes, the Vicarious website, as soon as I share the right site here. Okay, so Office for Victims of Crime, this is the website for it. Lots of different resources on here. I'm going to come up here and hit vicarious trauma. And there is a toolkit that you can use. So I have found that this toolkit's helpful for staff just kind of individually, but also as an organization, we've started looking at how this toolkit could possibly help our Sacred Heart crew. And it literally gives you a blueprint on how to kind of work through some things. It's not really like a catch-all. So like this isn't going to fit everybody, but it's important to help kind of like lay the foundation and kind of start the conversations on how this could potentially be used in your organization. So what we found when we started looking at this, that outpatient is exposed to lots of different things than what residential might be. We also have a jail program here at Sacred Heart, so the jail program also has different exposures and different things that they might work through. So looking at this website and kind of seeing what different tools are available has been helpful to be able to kind of start those discussions in our agency. So step one is to lay the foundation. Step two is assess current organizational capacity for addressing vicarious trauma. And then determine the priorities is step three, and in an action plan. So one of the things that we kind of started the conversation about is if we really take vicarious trauma seriously in our organization and we really start addressing it, what is our action plan? Like, how can we make sure that we're following through on things? One of the things that we made sure that we were holding ourselves accountable to is our environmental health and safety committee. When we have a high stress situation, so if we have like a de-escalation situation, if we have to call a code security, or if we have to call a code red, we had to call a code blue the other day. We meet with our team after we call those codes and start talking about them. That's something that you would think that you would do on a normal day-to-day. But again, when you have a mixture of employees that have been here for 20 years versus someone that just started, some of that stuff kind of gets lost in all of the experiences that we're talking about. So just kind of debriefing after that. But then looking at the outpatient side of things, you might not have as many high stress situations or codes and stuff like that. So we started talking about, well, is there a certain client that, we can start looking at case studies with our outpatient therapist and really start looking at, is this client progressing, not only progressing, but the conversations that they're having with the therapist that's assigned to them. Is the therapist okay with those types of conversations? Maybe that therapist is carrying something for themselves or just is not capable of kind of coping with what they're being exposed to. So looking at, do we have the right people with the right clients? So just little things like that we've kind of started just in our agency to kind of make sure that we are taking vicarious trauma seriously. Exploring the toolkit for resources and implementing your action plan is pretty huge. There's different filters on here. There's different disciplines that you can kind of use to figure out if whatever you might want to search on here. There's also grant funding available through this. I found a couple of links when I first started looking at this. But like the 911 Wellness Foundation, they'll have all these links in here. So you can come in here and like literally just start kind of being like, well, this matches what I'm doing in my realm, and this might make more sense for me. Wanted to give to you guys the actual tools. So if you are a supervisor or an organization that is interested in exploring vicarious trauma, there's actual like a framework. There's organizational strategies. Some of them will give you like how to like kind of talk to the staff. There's a glossary of terms to kind of help make sure that we're staying on track. And that's something that we found when we were exploring vicarious trauma at this location, as well as during COVID with my last organization, that things kind of get messy and they kind of start all running together. That's why it's very important that we're all kind of working on our own happiness and our own well-being. So that way when we come to the table and start talking about these issues, we kind of know what we're actually trying to communicate. There is a whole list of resources that it's not letting me get to. So I'm probably clicking the wrong link. Okay, so this is the tools for victim services. And it has a bunch of different PDFs, and it does specialize like for like law enforcement, police, fire. There is no actual form for anybody that's like kind of like in a therapy role. But you can kind of like pick and choose what you want to implement. So again, like it's not a one size fits all sort of toolkit, but you do get kind of a good idea of like how you would want to use this. So there's just questions in here that staff can provide feedback on for like leadership to kind of maybe make some improvements. But there's also some self-reflection situations in here on, as a staff member, am I communicating appropriately? What else do I need to be successful? So just little things like that it does make a huge difference. I know my staff, they eat lunch together, and I make it a point not to go in there because they could be talking about their dogs and cats, or they could be, just relying on each other to help kind of get through a situation. It's not unusual for staff to come talk to me after lunch because their lunch conversation got them to a point where they're ready to kind of communicate what their needs might be. So definitely allowing those organic conversations to happen is going to be vital to addressing vicarious trauma as well. So just, I would encourage you guys to all look at this and kind of go from there. Do we have any other questions? Could I put the website in the chat? I will do that. Do you need me to do anything further, Christy, or are we okay?
I was just looking back through the chat just to see if there was any questions that were missed, but I think you covered everything. So I think we're all set.
Okay. I do want to also plug the PTSD 9/11 movie. There is also a book about it. And if your organization is large enough, you guys can actually apply to host a screening or just order the film and toolkit for yourselves. It is very powerful and very impactful to kind of look at and kind of see. I know a couple of my team members, they hadn't really seen things from that side of what's shown in that video. So it's just kind of nice to kind of open some eyes because we're just kind of stuck in the trenches doing it. Sometimes we forget that sometimes what we are exposed to isn't normal. So thank you guys for asking questions and participating. And thanks for showing up today. Appreciate y'all.
All right. Thank you so much, Corey, for sharing your time and information with us today. I want to thank everyone else for joining us today. We hope the information was valuable and meaningful to you. Today's presentation is just one of many webinars being offered throughout September as part of a recovery summit. We have one more session next Tuesday. It will be presented by Dr. Moore and is going to be on a deeper dive into inhalants. For details and registration on that last session, you can go to our website at www.sccmh.org under the events tab. Also, please keep an eye out for a short survey in your email. Your input is vital in helping us continue to improve and shape future events. For those requesting McBAP and peer certificates, they will be emailed out in mid-October. And if you're requesting social work CEs, your certificates will be emailed out to you after payment is received, if applicable. And I think we are working on those invoices, so those will be going out soon. Thanks again for joining us today, and thank you, Corey, again for joining us. We look forward to seeing everyone at our next session.